I'm Chad Laurich. I'm a vascular surgeon and interventionalist at the Vascular and Vein Institute of Siouxland in Dakota Dunes. This is a brand new clinic with a pretty phenomenal all-stars in our staff. I've been very, very blessed to have the team that we do. I got to pinch myself sometimes because of how good these folks are. From our nurses, Megan, Carol, and Mandy, my ace in the hole, my nurse practitioner, Amanda Anderson. These folks are just absolutely fantastic. The real thing that we have in our clinic is just a culture of caring, because everything that we do is influencing patients' lives. So I went to medical school at the University of Minnesota, did my vascular surgery at the University of Iowa. That's where I fell in love with vascular surgery. There were some fantastic older vascular surgeons there, and I saw how they operated, I saw how they interacted with patients, I saw just their passion for what they did and how they did it. And that really made me fall in love with vascular surgery. I saw vascular surgery undergoing a tremendous change from a classic surgical specialty where everything was a big open, surgery with all the risks inherent in that, to a very minimally invasive field where we could do amazing things with very minimal impact or risk to the patient. I saw that change coming and it was in front of my eyes, and that made me really excited about joining the field and being a part of that kind of new wave of technology and treatments and abilities that were coming to the vascular patient. Most treatments that we're able to offer today are minimally invasive. From repairing aneurysms and enlargements in the vessels to repairing blockages in the vessels, we can do most things without having to put my hand to a knife. For example, in peripheral arterial disease, which is blockages in the main arteries that supply our legs, we used to have to do a big surgical bypass, quite a big ordeal for folks. Now you can come in with an hour-long procedure, sometimes a little less, sometimes a little more. We can effectively clean that vessel out, restore normal flow down that leg, and you walk in, have it done, and you walk out. We are striving very hard to have a fantastic experience for them. From the time when they make their appointment, maybe when their referring physician calls in or the patient's calling directly to make their appointment, we want to make that an easy process, to getting them scheduled in a timely fashion, to when they arrive, the check-in process, and to seeing warm, friendly faces that are there to help them, to efficiently seeing them in our clinic. I've always tried to be an example of really connecting with my patients. That's one of the biggest joys that I have. Spending time sitting down, talking, going through their situation, going through what problem they're having, and explaining that to them, to the patient, to their family, being sure that everybody understands what the treatment options are, from medical treatment to minimally invasive treatment to potentially surgical treatments, and just going through that spectrum and being sure they understand the pros and cons of each and making the best decision for every patient. That's really what we strive to do.